Good afternoon, everyone, and welcome. Today we're presenting the 8th webinar in our series on CCDBG in the first 1,000 days. Our focus in all of the webinars is how to maximize these dollars to support infants, toddlers, their families, and the providers who care for them, teach them, and love them. We have tried in each webinar to raise the issue of disparities and to suggest strategies that advance racial equity. Today's webinar hones in on the topic of equity right from the start. I'm Danielle Fuentes-Johnson with the BUILD Initiative, and I'm pleased to be facilitating today's webinar. Due to the large number of participants on this webinar, we will be operating in broadcast-only mode. However, we want this to be as interactive as possible and encourage you to ask any questions you may have, share any relevant resources or experiences in the chat box. The other presenters and I will be keeping an eye on the chat box for your questions. If we miss any, Susan Hibbert, Executive Director of the BUILD Initiative, will help us pause to have the speakers answer your questions as time permits. I will introduce each of today's presenters as they are about to speak. But right now, I'd like to take a moment just to briefly say a few words about this series of webinars. We're all on this webinar because of a great opportunity. In March, Congress increased fiscal year 2018 CCDBG funding by approximately $2.4 billion. We're going to pause just for a moment to make sure that everyone can hear. I think we're having a technical issue. Just one moment. We're going to pause just for a second.
I fixed it, Danielle.
Okay, perfect. All right. Well,
Christine, Nikisha, do we have you?
Yes.
Okay.
Yes.
We weren't
Stand
moved. Okay.
Oh,
Thank you.
fantastic.
Sorry.
All right.
Go ahead.
Sorry about that. So we are going to take just a moment, and I'm going to back up just one slide very briefly. Introduce myself. I'm Danielle Fuentes-Johnson with the BUILD Initiative, and I'll be facilitating today's webinar. Due to the large number of participants on this webinar, we will be operating in broadcast-only mode. However, we want this to be as interactive as possible and encourage you to ask any questions you may have, share relevant resources or experiences in the chat box. The other presenters and I will be keeping an eye on the chat box for your questions. If we miss any, Susan Hibbert, Executive Director of the BUILD Initiative, will help us pause to have the speakers answer your questions as time permits. I will introduce each of today's presenters as they're about to speak. But right now, I'd like to take a brief opportunity to say a few words about this series of webinars. We're all on this webinar today because of a great opportunity. In March, Congress increased fiscal year 2018 CCDBG budget and funding by approximately $2.4 billion. This is the largest increase in CCDBG history. According to the budget deal, CCDBG funding for fiscal year 2019 should increase by $3.4 billion in order to meet the $5.8 billion increase outlined in the budget. However, Congress is not required to do this. The focus of these webinars has been, what can you do with this money? The new money can help states implement reauthorization provision. Many states will also use it to raise rates, expand access, build supply, and invest in the early childhood workforce. How you do each of these things matters. Some strategies more specifically address disparities and improve access to quality for the babies and toddlers with the highest need, whose families have faced the greatest barriers to opportunity. We look at our core principles. Because of this historic opportunity, the BUILD Initiative, CLASP, the Center for Law and Social Policy, and 0 to 3 came together with funding from the Pritzker Children's Initiative to raise awareness of the ways that states might want to maximize the new federal dollars to support the least funded age group in the education continuum, infants and toddlers. The partners came together around some core principles. We're not interested in pitting funding for babies against funding for older children, but we know that more attention must be paid on the unique developmental period that is infancy and toddlerhood. And we know that for all young children, a 2 or more generational approach is critical. Babies are nurtured in families, and these families live in communities. We must recognize the whole child in her specific context. We are urging state leaders to think creatively. Yes, we must implement reauthorization, but there's a lot of latitude and many different ways that to improve health, safety, quality, and access. We need to identify the barriers in our states, identify disparities, and address them. And we need to think about all the settings that serve families with babies and toddlers. As we focus on young children, it is critically important that we focus on all the important adults in their lives. Very prominently, that includes the early childhood educators who are woefully underpaid. We need to focus on professional development, program supports, and compensation. In this series, we've had at least 2 webinars that focus almost exclusively on strategies that build the supply of high-quality infant and toddler care. We all know of child care deserts, and we know that the barriers to providing high-quality care to infants and toddlers are high, so supply building of quality care is a significant need. And later in the series, we'll have a webinar on documentation, information sharing, and engagement to identify and sustain the advances that we will make with these new federal funds. Now I'd like to introduce our first presenter. Christine Johnson-Stab is an interim director of class child care and early education teams. She has a deep expertise in systems building, design, and implementation of quality rating systems, child care subsidy programs, and policy and technical assistance. Christine is a leader in the focus on CCDBG and on equity in early childhood. Christine recently authored Equity Starts Early, Addressing Racial Inequities in Child Care and Early Education Policy. A link to this will be available on the landing pad along with today's PowerPoint and other resources after the webinar. Welcome, Christine.
Thank you. And thank you, everybody, for participating today. I know there's been some audio issues, so I'm hopeful that everybody's getting those worked out. And as that's happening, I'm just going to go ahead and get started. I'm not sure how familiar everyone is with CLASS, and I'm just going to say a little bit about what we do. We're the Center for Law and Social Policy. We are a national nonpartisan nonprofit with an anti-poverty focus. We work to advance policy solutions that work for low-income individuals and families. And we work on both the federal and the state level. And part of what we like to say we do is translating what's happening on the federal level for state audiences, including advocates and state administrators and other stakeholders, and then working with states, with those stakeholders and states to ensure that federal policy is implemented to maximize the benefits for low-income families, and feeding back information about how those policies are working in the states for the federal audience, so for federal policymakers, for members of the administration, and so forth. We do that in a number of policy areas, which include child care and early education, but also include youth development, workforce development, and job quality, and income and work supports. So we have a number of other issues that we work on. We also do some work, actually a lot of work, particularly in the early childhood area around immigration currently. And we are doing some work around, in the 2-generation realm, around mental health, maternal mental health, and also youth mental health. In general, across all of those teams, we approach our work with a lens of racial equity and with a multi-generational approach. And it was in that vein that we released Equity Starts Early back in December of last year. And we wrote that report really with the goal of trying to get grounding in what the racial equity context has been historically for the child care and early education policies that we work on, which include child care, Head Start, and state preschool programs, and also to put in place a broad understanding of how racial equity challenges have continued in those programs and in the field, and what some possible solutions to that are. I have been surprised by the different types of audiences that have responded to the report, but I want to say up front that I think for all of us, for CLASP and for all of us, that racial equity and working on racial equity as we integrate it into our work and as we work on it internally in our organizations, it continues to be a work in progress and something that we have to keep working at and keep talking about and keep educating ourselves about so that we can improve not just policy but how we all do our work. So that is a little background on CLASP, and I'll get into the report and just some basic landscaping around equity in early childhood. So just another important note in terms of how we think about racial equity efforts. I like to say that racial equity shouldn't be about something that you're doing for communities, but supporting work of communities and allies to correct inequities. If I was going to rewrite this report right now, I would use the words support and engage a lot less frequently, and I would emphasize a lot more that communities of color should be at the center and at the helm of designing and implementing racial equity work and policies, and that allies should be supporting and facilitating that work. And I'll talk a little bit about principles that we approach this with. So like I said, Equity Starts Early included a history of inequity in early childhood programs and policies. We go back and look at, for instance, the racialization of language around the Child Care and Development Block Grant as it was created in relation to TANF. And also we look at the history of the workforce and how racialized domestic work in general, but child care work in particular, has been throughout American history. We look at current barriers and potential policy solutions in three buckets: access, quality, and workforce. And those are three buckets that I know every early childhood person is familiar with. And then we talk about how you can inform strategies and priorities for policy. You can ignore the word health there. I'm sorry, that's left over from a previous version of this. So to take a step back a little bit, and as we go through the content of the report, I'm going to try to highlight what I think are three overarching principles of our racial equity work at CLASP. The first principle is really that we want to use data to understand as much as we can, and that's something that, if you know CLASP's work, that's something that we really believe in, is using solid information and data to inform policy decisions. So, for example, looking at demographics, looking at language needs, looking at geographic difference, looking at utilization, but using the data that is available to policymakers and to advocates to really inform where the barriers and where the gaps are. The second principle is to lead with the voices of those who are impacted, which is sort of what I was saying before, that both in defining the problem and in designing the solutions, you have to start with the voices of families and individuals who are in the communities of color that are at the center of the work, and not try to, so in addition to looking at data, not trying to define from the outside what policy problems are and what policy solutions are. And then the third principle is really to apply that equity lens to every single question and potential policy solution that you work on. It takes a commitment to doing that, and not, it takes consistency. We will talk about some strategies that have been used in states, both around the data piece and around the policy piece. But it's really critical that you find a way to be really consistent about every time you approach a policy question that's related to early childhood, that you're thinking about it through the lens of racial equity. So over the next several slides, we're going to look at specific sectors of early childhood work broadly. And I'm just going to go ahead and move forward. So we've broken down racial equity issues into early childhood programs into 3 buckets, like I said before: access, quality, and workforce. And I totally recognize that the early childhood world is more complicated than that and that they overlap. But we're going to work with that for now because that's kind of the 3 buckets that seem to capture everything that we're talking about. Starting with access, first and foremost, there's not enough resources available. This is something I'm sure you've heard CLASS say many times and all of our national partners say many times. There aren't enough resources available, period, to meet the need for quality child care and early education. This is a national problem. And it is a state problem in pretty much every state. We can get into later the data that we have around the percentage of potentially eligible children who actually are able to access child care and development block grant funds through state subsidy programs. But it is a small percentage in every state of the country. It impacts how states make their policy decisions. The lack of resources drives a lot of the policy decisions that states make and how to administer their subsidy programs, and that limits access for everyone. But there are particular barriers for people of color and for children of color, and also for immigrant families that may be legal eligibility barriers or barriers that prevent families from accessing assistance that they are eligible for because they're afraid to go through the process or to go to the locations where it's available. So generally speaking, the inequities in access are rooted in some basic areas. The availability of quality programs. We know that there are not in many areas, and child care deserts were mentioned earlier, that there aren't enough providers in the community in many areas to meet the need for subsidized child care, even for those children who are eligible. And for children of color in particular, there are areas where there are child care deserts and where there's a lack of supply that meets either linguistic needs, cultural needs, or just that geographically it's not available in some of the lowest income communities. I want to echo something that Marie James said recently at the BUILD conference, which was that frequently we talk about communities of color as hard to reach communities, and it's not really about being hard to reach. It's that we have not designed our approach to child care and early education in a way that reaches those communities, and it's on us to figure out how to do that. So availability of quality programs is certainly one of the biggest gaps in terms of access and equity. Another gap, which is huge, is affordability, and that is that children of color have less access to available financial support, subsidies, and no-cost programs. At CLASS, we've done a lot of work around disparate access to child care, looking at who's potentially eligible in states and who actually has access, and finding that in particular Hispanic families and Asian American families have less access than other groups of children given equal eligibility. And then the other area where there are real gaps is in family choices and information. So looking at the information that's available to families about the availability of subsidies, about what programs are available, how to choose high-quality child care and early education. That information is not always available in a culturally or linguistically appropriate way to reach families who are most in need. So that's another barrier. And then, as I said before, there are real and perceived barriers to access for immigrant families. That's something we're deeply in the thick of right now, and I'll just point to, if you go to CLASS' website, that we have a number of resources available now and more coming in terms of how the current immigration policies and enforcement policies are impacting children's and families' access to child care in general and high-quality child care in particular. And how it's impacting their experiences as well, and also the impact on providers of those policies. So we looked at, in our report, we looked at those areas of inequity, and there's a lot more detail in each of them. I'll just keep moving here. So thinking about some potential strategies to solutions, I think that the obvious one that I always want to lead with is to increase investments towards the availability of child care assistance and early childhood programs. Early Head Start, child care subsidies, and we're focused today on CCDBG, but I think in general, investing in early childhood is going to create more availability for others, but it's not for everyone. But it's not going to solve the problem of inequities unless it's combined with other strategies, such as working with partners in the community to better understand the needs and barriers to access. I want to highlight again what I said earlier, which is that we're going to talk about some potential solutions, but all of these solutions should be designed with active participation and leadership of the affected community and using the available data. So when I say work with partners in the community to better understand needs and barriers to access, what I'm really saying is start with a conversation led by communities of color, whether that's through a geographic outreach or through other types of community outreach, to make sure that it's actually clear that you're defining policy goals with centered on what the communities of color want to have access to in terms of child care options. Making sure information about assistance meets specific linguistic and cultural needs of the targeted community. I think there's actually a provision in the child care law now around consumer education and around meeting the linguistic needs of individuals in the state or families in the state who are eligible. So that's something that is really reinforced by the Child Care and Development Block Grant, but it's also just good practice to really use data and to also use communication with communities to understand what the linguistic and cultural needs are, and then making sure that the information about the availability of child care subsidies reflects those needs and those practices. And then paying special attention to barriers or perceived barriers among immigrant families, which takes a lot of effort to really understand how families are experiencing access to public programs in general, and then to child care, and understanding the legal parameters. Just the thing I would highlight immediately is that under CCDBG, the eligibility for a child is based on the child's immigration status. So if the child is a legal resident, if the child is a citizen, which is often the case in mixed status immigrant families, that child is eligible for CCDBG funded child care regardless of the immigration status of their family. And that's something that I think it's one thing to know that intellectually. It's another thing to work with providers and with administrators to support that access, and to work with trusted partners in the community to ensure that families know that their child is eligible and that it's a safe place for their child to be. So there's a lot to unpack there, and I would just again refer you to our immigration work. But I think that's one of the pieces that can really help improve equitable access. I think I'm going to keep going here. Just one more note on working with partners. I think when I say working with partners, I think one of the things that we all need to get better at thinking about is how we identify partners. I think in most states there are deeply rooted child care communities of traditional providers and traditional advocates, and taking a fresh look at those communities, and particularly looking at the data and where your gaps are, where there's a lack of access for families of color or for immigrant families, and thinking about how best to reach families who they currently talk to, who they trust, who they work with. So that's information that you only get really by talking with the families themselves and listening to their answers. So thinking about who the trusted partners are in a community, whether they be faith-based organizations, whether they be immigrant organizations or organizations that work with immigrants, or whether they be other types of nonprofits that are at work in the community. I think understanding who the trusted partners and messengers are in particular communities is a really important first step to having the conversations that create more effective child care policies.
Christine, I don't know if you saw the question but there was a question from Rebecca about the national class standards, the standards for culturally and linguistically appropriate services and healthcare, and she was wondering if providers would be aware of those standards.
So I don't actually know the answer to that. I don't know how they're being.
Yeah, my guess is that it's really going to be variable depending on the dissemination strategies and, and who's been reached. I certainly, Christine, would you agree? I don't think that they're probably widely known or understood by providers.
I don't think they are, and we'll talk a little bit in the quality section again about outreach to providers and reaching providers of color in particular. I'm not familiar with how they're distributed, so I just really can't say how available they are to particular communities. I'm sorry. But it's something we could follow up on and definitely look more into. I would be happy to do that.
And it's a great point. I think there are obviously materials available that just aren't necessarily disseminated well or well known. So good for us to look out for. Thanks for mentioning them.
Yes, I agree. All right. So moving on to onto the quality bucket. Inequities in the quality of care and early learning experiences children of color have are in part rooted in how we define quality, in our concept of quality, and how those are developed through policy and the resources it takes to support quality that may be less available in communities of color. And I think that that question actually raises part of that question about what resources are available and how they're disseminated and also how they're developed. So just some examples of how inequities are created or persisted through quality policy, definitions of quality tied to funding and licensing, and that can include QRIS, but it can also include licensing regulations, obviously, and other types of quality standards. Don't always reflect the cultural and linguistic identities and differences among families and also among providers. So thinking about if you're developing quality policy, including and centering families of color and providers of color in that conversation around developing quality standards, I think is really critical. I think it's something that we've gotten much better at over the years, but I think it's still a big gap in terms of quality equity. And the cost, language, and cultural barriers to achieving those quality goals limit the reach of quality initiatives in some communities. So if you look at, for instance, how a QRIS or how other quality standards may reach some communities and not reach others, it goes back to the same issues that you experience in terms of access or in terms of professional development or in terms of other parts of the child care system, that if the quality initiatives and supports aren't designed in a way that address language barriers and address cultural barriers, or if they are high cost, and I think we know that communities of color in general have higher rates of poverty. I think certainly providers in communities of color have less resources. So achieving or tend to have less resources. So meeting quality goals is a high cost proposition. That's a barrier that's built into the system there, a barrier to equity. And then thinking about quality efforts focusing on workforce skills, program design, and provider diversity. Those are all areas that without paying attention to them can really create and exacerbate inequities in quality policies. We haven't talked explicitly about the Head Start model, but it's strong in the areas of quality and workforce development and in community needs assessment, as probably most of you are familiar with it. I think throughout the report that we wrote, we really highlighted a couple of places where Head Start really is the model in terms of, for instance, promoting, looking at family engagement with a racial equity lens. but there are, and also addressing the linguistic needs of children. So there are some areas where Head Start really has some specific strategies that are a model, but I think in general, I want to point to it just also in terms of centering the community piece. Head Start was created, as I'm sure everybody knows, as part of the civil rights movement in response to underserved communities, and thinking about how to put resources directly into communities of color to address inequities in opportunity and achievement for young children in those communities, and by putting the resources directly under the control of community partners who are trusted in the community, and to design programs that met the needs of the community, it is really still a model in terms of racial equity. Not that it's perfect, and certainly in our disparate access work, we still see inequities in access to Head Start. Again, rooted in a lack of resources, but also I think the structural requirements around community needs assessments offer the potential for really solving or addressing some of those unmet needs. So in terms of quality strategies and solutions, one of the key recommendations is partnerships with Early Head Start and efforts that build on Early Head Start as a model of quality, to the extent that you're able to promote and expand those initiatives in your state. Training and cultural competence, teaching dual language learners, and racial bias for early childhood programs. So, I think, and we'll talk about this a little bit in the workforce section as well, it's complicated, right? Because it's not just about creating quality policies that reflect the needs of diverse populations. It's also about how you support providers internally in developing their own cultural competence, teaching how to work with dual language families, and also addressing their own racial bias. I think one of the big issues that's really prominent in conversations about quality and equity in early childhood is the suspension and expulsion as dynamics that children of color are more likely to be suspended in early childhood programs, just like they are in K through 12 K through 12 education. And so that takes a combination of policies that prevent suspension and expulsion, but also on really focusing on working with the workforce to recognize and address their own racial biases and differences in how they treat children. And then finally, quality supports within underserved geographical, racial, and cultural communities. I think this gets back, to some of the same themes as access in terms of how do you deliver the resources that the state makes available around supporting quality to make sure that they are reaching communities of color, to make sure that they are reaching underserved communities, to make sure that they're available to multilingual programs and providers, and addressing those sorts of barriers. So I think we'll keep moving at that point. So although the slides may not be completely explicit about this on every point, I want to reiterate that it's really important that all anti-bias and racial equity work be informed by and really centered around and ideally led by impacted communities. That racial equity efforts should not be about something that you're doing for communities, but supporting the work of communities and allies to correct inequities. I just feel like that's, as you're approaching the quality work, and also now we're going to talk about the workforce, that's a really important principle to keep in mind. The workforce area is complex, like I said a few minutes ago, because our early childhood education workforce both has a responsibility to promote racial equity for children and be equipped and supported to do that work, and the workforce experiences its own racial inequities, which leaves workers of color in the lowest paid and least respected positions pretty much across the board. The workforce isn't consistently trained and supported in cultural competence and working with dual language learners. The early childhood workforce is stratified. We'll look at an example of that in data in a few minutes. But there are a number of research resources that show that teachers of color are most often in the lowest paid and least respected positions. And if you look at the beginning of our report that we released in December, there's some real historic roots to that, not just in early childhood, in other fields as well, but I think it's really important to understand just how deeply that stratification goes into our history of the early childhood system being developed. And then, again, professional development resources and supports aren't equitably available for workers. So just to kind of unpack what that looks like, to think a little more about how you can, and also to think a little bit more about how you can use data to identify equity issues in your own workforce in your state. This is an example, and it's probably somewhat hard to read, but hopefully you can zoom in a little bit. That is an example that was done in California. Actually, the slide uses data from 2004, so it's a little bit old, but it was provided for a conversation that we had at the Build conference with Steve Murray. James from NBCDI contributed this slide, and the next one. I just want to make sure she has credit for that, for contributing those slides. But what these numbers show, and again, it's one place at one time, but it's an example of how you can look at data. What they show is that white non-Hispanic workers and staff tend to be in the higher positions, and that African American, Latina, Asian Pacific Islander, and other staff tend to be in the lower paid and lower respected positions within the early childhood workforce. So this has K through 12 numbers, but it also has the child care providers, center teachers, assistant teachers, and directors. So you can see a comparison. And if you looking solely at the directors, you see that 63% of directors are white, non-Hispanic. Meanwhile, 9% are African American, 16% are Latina. So there's definitely a gap there. And if you back up and look at assistant teachers, that number flips a little bit. So 37% are white and non-Hispanic, while 42% are Latina. And so this is, again, these are California numbers, so they may look a little different from what your local numbers would look like. But how that reflects the children who are in services birth to 5 years old, or California children in general birth to 5 years old, is that, while 63% of the directors are white, only 30% of the children are white, non-Hispanic. Meanwhile, 16% of directors are Latina, but 50% of the children are Latina. Are Latina. So ideally, and experts in child development know this, ideally you want your programs and your providers to reflect your population of children. That's good for children. It's good for their development and for their developing a strong sense of self. And there's lots of research that backs that up. But even setting the child development goals aside, stratification of the workforce by race is simply just creates a socioeconomic inequity between the white workforce and the workforce of color. And so for kind of socioeconomic justice purposes alone, that's an issue that needs to be addressed. So just going to the next slide, same source, which isn't noted here, so I just wanted to say that. But this looks at how stratification is related to workforce requirements and degree requirements. So we know as early childhood professionals that degrees are important, that having a highly educated workforce is critical, and that particularly in the infant and toddler settings, that it's not it takes a lot of understanding of the development of babies to really give them the best start. And so a lot of our quality standards nationally and professional development standards reflect that, and that's fair and that's good. But what this shows is that as you go into, as you look at who in the early childhood workforce is working and who has BA degrees or higher, the numbers again really shift. So while all licensed family child care providers, 35% are Latina, only 15% of licensed family child care providers with a BA or higher are Latina. So that kind of difference is something that really has to be considered when you're designing quality standards and outreach programs and professional development programs to ensure that they really create access to post-secondary education, to professional development opportunities for the people of color who are working with our children, so that they are able to, who are working with children, so that they're able to achieve the higher standards that are being set. Again, this is the tension that we have, that we want to set higher standards because we want to deliver high quality care. We have to do that acknowledging the barriers, the additional barriers that workers of color face to meeting those higher standards, and address those barriers and not accept them. I think that goes, hopefully that goes without saying, but I feel like it's really the lesson from these slides. And again, this disaggregated data, this is just a great example of disaggregated data and how it can help illuminate some of these equity dynamics that we struggle with in the field and that then impact the experiences of our kids. So I'm going to go through the last couple of slides really quickly because now I'm realizing that I'm running behind here and I don't want to go into Dahi's time. So some workforce strategies and solutions. The solutions are rooted both in building respect and compensation for the whole early childhood workforce while addressing stratification and raising expectations of the workforce to better understand racial bias and take responsibility for leading classrooms in a way that is racially equitable. So again, it's about creating equitable access for the workforce and also working with the workforce so that they are creating a racially equitable experience for the children who they're serving. So some of the strategies and solutions can include meaningful anti-bias training for the early childhood workforce, intentional workforce development efforts targeted to address inequities, and increased access to workforce development for non-English speakers and other marginalized caregivers through community partnerships. Again, drawing on those trusted messengers and partners in the community. Before we go to Dahi to talk more explicitly about opportunities in working with the data, I just wanted to quickly provide a picture of young children from a racial diversity and equity perspective that will hopefully prime the pump for the conversation about data. What we know are that children and families of color are more likely to live in poverty or be low income. The numbers are here, so I won't go over this in detail, but it's pretty dramatic, and that that is particularly so in families with the youngest children, and that there are certainly systematic barriers to accessing childcare. Again, I will point to our disparate access work where these numbers come from so that you can go there and look at these more closely. But what our analysis of 2011 to 2013 CCDBG data showed that fewer eligible Hispanic, Asian, and American Indian and Alaska Native children receive CCDBG subsidies than the national average, which is about 13% as it is, so it gets back to that resource question. And then that all of that is both that children of color are more likely to be in low-income families, that they are less likely to access childcare. All of that is exacerbated by the reality also that parents of color are more likely to be in low-wage jobs, which in our society right now means that they are more likely to have unstable schedules that change periodically. They know their schedules at the last minute, that they may be in and out of part-time work and combining 2 or more part-time jobs. So all of that stress around being part of the low-wage workforce is more present among families of color than it is among white families. And that, again, is, there's more about that in the report that we wrote. But I just want to put that out there as context for looking more closely at the children in your community and the families in your community and how you can address racial equity issues. And now I'm going to pass it on to, I have a page here of resources which you can look at later, but all of the reports that I've mentioned are linked here. And I'm going to pass it back to Danielle. Thanks.
Thank you so much, Christine. Thank you so much. And before we move on to introduce Dahi, we'd like to ask you all a question. Just take a moment. Does your state disaggregate data by race, ethnicity, home language? Just go ahead and take a minute. We're going to go to the poll. We'll just pause for a minute and give everyone a moment. And you can continue to enter any questions you may have for Christine in the chat box as well. And we'll circle back to those as we have an opportunity. A few people have let's see.
I'm not sure the poll is working.
Oh, go ahead and answer. If you want to go ahead and put your response in the chat box, we'll go ahead and capture it that way. We'll take a moment. A lot of I don't knows. There's some data and not able to access it. Sometimes it depends. Well, while you go ahead and enter that information, we appreciate everyone that's giving that feedback. This will be a snapshot of today's attendance. We want to go ahead and introduce our next speaker. Our next speaker is Dahi Wolf. And Dahi has been an early education policy analyst at Kids Forward in Wisconsin since 2007. He's the co-chair of Healthy Early, an award-winning statewide coalition that works to improve nutrition and increase physical activity in child care settings. He's currently grant manager for the Farm to Early Care and Education Project, funded by the W.K. Kellogg Foundation. So his commitment to healthy child development is clear. Dahi is joining us today to talk about disaggregated data by race and ethnicity and what that can do to help us identify these gaps in opportunity and strategies to advance equity. Welcome, Dahi.
Thank you. I'm glad to be here. Hopefully everybody's having a great day and learning a lot. I'm going to start by just talking a little bit about my organization. I'm at Kids Forward, and we actually started in 1881. So I believe that we're the oldest child and family advocacy organization in the United States. And we just changed our name a year ago. We used to be called the Wisconsin Council on Children and Families, and we decided we wanted a shorter and better name, and so we're called Kids Forward, and our tagline is every kid, every family, and every community, which reflects our renewed commitment to not just addressing poverty, but also for the last 5 years we've made racial equity a priority here in all our work, which kind of leads to the fact that we are looking at disaggregated data whenever we can. Just a couple more things about Kids Forward before I move on. We're a multi-issue agency, so we're the Kids Count organization for Wisconsin. We also work on juvenile justice, tax and budget, social determinants of health, immigration, and then, like I said, since about 2012 or 2013, we've had a project that we call Race to Equity. And we started with looking specifically at Madison and Dane County here in Wisconsin, and the results that we found weren't entirely surprising to a lot of people that had been tracking that kind of stuff, but when it got out to the whole community, I think people were pretty shocked that a university town, a capital, a progressive community would have such glaring racial disparities that showed up across all different areas, whether it was incarceration or education or health or access to early childhood education, et cetera. So in 2013, we released our very first Race to Equity report, which looked at a baseline of racial disparities in Dane County, and specifically at African American families and children and population. And we now, in 2018, are getting prepared to release the 5-year follow-up to see if things have gotten any better, which we hope, because our community has to some extent taken this on and acknowledged the fact that these disparities exist and that they didn't just show up here all by themselves, and that there's solutions that can change them. So we have a project that's called the Roadmap to Equity, which is basically trying to map out strategies that have come from people in the community and organizations that are interested in this to improve employment and health and home ownership and education and deal with expulsion and the pipeline, the school-to-prison pipeline, and lots of other things. So I'm going to talk just a little bit about a broader perspective, which is that Wisconsin as a whole has tremendous racial disparities. And I'll just kind of quote from one of our sister organizations, the Center on Wisconsin Strategy, a report they did last year, which says Wisconsin's racial disparity is extreme. That disparity is evident across a broad range of indicators. And the racial disparity in Wisconsin is not inevitable, and I think that's why we're here today, to say there's something we can do about it. In fact, looking at the data from about 30 years ago, most of these disparities did not exist. They were created by the systems and by the government policies and by the different economic opportunities and by institutional racism that created these disparities. And reading that and reminding me, gives me hope that we talk about the fact that racial equity is a goal that is very challenging, but it's a system that was created, intentionally in many ways and unintentionally in other ways over our history as a country, as history as a state, and as I think Christine mentioned, in the early childhood education system, we know that a lot of that exists from the data that we just looked at. So I'm going to move just to talk one more thing about Wisconsin in general. I think people will be surprised, for example, that Wisconsin's overall rank is 46 out of 46 states that reported in terms of child well-being for black children. So if you look at this graph here and look across the line that says black, the ones that have the orange triangles are the ones where we were the worst of all the states. And particularly, like I said, that's true in Dane County. And we are specifically looking there, but now we're looking much more statewide. So this leads me to what we decided to do next, which is that we have made it a goal of our organization. We collect a lot of data on a lot of different things, but it is our goal, whenever possible, to disaggregate data. And basically that just means that if we have the ability to collect data that is broken down by race and by ethnicity, that we will look at that and then make comparisons toward looking at disproportionality and disparity. Because ideally, we're talking about a system that is equitable, and that means that the color of someone's skin does not determine the access. So that a black child in Wisconsin would have the same opportunity as a white child to attend a high-quality program. As we look at these numbers, I know we're focused on infants and toddlers. We were not actually able to break it down between infants and toddlers and older children in terms of this by race and by quality. But if I had to guess, I would say that it's potentially even worse if we broke it down just by kids 0 to 3. But I don't have that as hard data right now. So the next slide looks at what we found out, which was entirely unsurprising, which is that we guessed that as soon as we were able to obtain data and look at the access that children had to, these are children on subsidy. So we have the Wisconsin Shares program, which is our CCDBG funded program for families that are under 185% of poverty and are working or attending, job training programs. So these are all low-income kids throughout the state. Over half of them are in Milwaukee, and which is our largest population center and our largest place where there are African American kids. So basically, I'm just going to focus on the fact that you see that line that goes across the middle at 100%. That is basically the access that white children have to higher quality programs. So those would, in our state, we have a 5-star system, so those would be the 4- and 5-star programs. What we're looking at is on the left-hand side, over the 3 years of 2014, 15, and 16, pretty much very similar participation. 40% of black children had that same access. So you can see that there is a huge gap or a disparity in access, and our goal is to raise those bars so that they are up to the equitable level where the black line is. And this, we don't have 2017 yet, but we expect it to be very similar since most of the trends are pretty solid. The numbers on the right with Asian and Pacific Islander and Native American are much smaller numbers, so I think there tends to be more variability. So what else I want to say is that, like I said, these disparities exist. We predicted they would, and now because we've been able to get this data from our Department of Children and Families over multiple years, we can concretely say what they are, and we can say we have a goal to change them, to make things better, to make things more equitable. So the one thing that we just did recently is in July we held a meeting with 5 African American child care directors in Milwaukee who all are part of 5-star high quality programs, and we presented some basics of this data and talked about what could be the causes, the barriers, and the solutions. So I think that's that idea of start with data, then lead with voices, and then, of course, use an equity lens moving forward. A couple things just about the barriers or the reasons that this exists. There are actually zip codes in Milwaukee that don't have a single high-quality child care provider. So you've got an urban area with a whole lot of kids and no provider that serves that area where the kids on subsidy could actually enroll without having to go to a different neighborhood. Also, we've heard this before, that there's a lot of misinformation, and I know that got mentioned earlier by Christine in terms of making sure families know about access and why high quality is important, et cetera. And part of the misinformation is that when you get subsidy, you are eligible to go to any star level that you choose. It's not. And I think the misinformation was that a lot of people thought, well, they can only afford the cheapest and the lowest quality. And it is true that the co-pays would be different and would be higher at a 4 or 5-star center in general. So there is somewhat of a cost difference, but for the most part, the eligibility is not a factor, and that is something that needs to be clearly explained and encouraged, that there's a real difference for your child to have the experience that they'd have in a higher quality center.
Dahi, before we
go ahead. Sure.
We have 2 questions really quickly before we introduce our final speaker. Do you have disaggregated data on native versus foreign-born, as well as another question is, once the resources have been assigned, do you believe that 211 call centers can assist to get the word out for educators and families? So 2 questions.
I'll answer both. We do not have any data on immigration status or home or nationality or country. That was not part of it. And before I answer the other question, I'll say that the data that we did get is very challenging for a couple of reasons. One, the answering this question to the Department of Children and Families is actually voluntary. So about 20% of the participants did not respond, or just, there's no information available. So our data is based on the 80% that did report a race and or ethnicity. And the other factor was that it was not a list to check. It was an empty box. And so when we were first sent the data, there were actually 67 different categories because of all the different combinations that people reported. So we had to make some challenging decisions on how to combine those to just come up with what you see here in this chart. So that was a challenge. But there was no other data other than race and ethnicity that we got.
Okay.
And to the second question, I agree. I think 211 would be a great resource, and that we should team up together with them in terms of connecting people to high-quality child care. Since I don't have much time left, I'm going to say one more thing, which is that what was the suggestion that these child care providers had? And I'd say their biggest suggestion was in terms of expanding the availability of these high-quality five-star centers, was that there's been a lot of work done to try to help lower quality centers like 2 or 3 stars to get more education, professional development, to move up on the system. But their opinion universally was that that's a much bigger ask and a much more long-term and challenging goal than actually duplicating the successful program. So taking a program that already exists, that is in the community, that has qualified teachers and is shown and to have a diversified workforce and to really be meeting those standards and providing a great service for those children, that having some way to subsidize or to encourage them to expand to those zip codes that do not have any programs, or to basically clone or duplicate themselves. And in fact, one of the centers that was represented had just done that. They had moved in from one side of town and kept that facility, and that built another facility that duplicated it. But I have to say a caveat: all these programs were not standalone in terms of their financial support. They did not, they could not make ends meet just from subsidy. They all were part of other nonprofits or philanthropy or other kind of places that supported their work and were able to keep them their doors open and pay their teachers well enough to keep teachers with degrees, et cetera. So it takes a partnership to make these things happen.
Thank you so much, Dahi. In the moments that we have left, we do see that there are a few other questions. If we have time at the end, we will circle back to those. If not, we will connect with the speakers to have those questions answered and get back to you. Right now, we'd like to turn to Nikisha Knight-Coyle, who is the Director of Early Learning Programs and Cross-System Integration for Oregon Department of Education. Nikisha oversees state and federally funded programs for children aged 0 to 6. She sees her life's mission as one of service to populations disenfranchised by biased systems and antiquated structures that exacerbate rather than mitigate institutional racism and oppression and perpetuate poverty and disparate health and educational outcomes. She's one of the first cohort of Equity Leaders Action Network Fellows with the BUILD Initiative. Welcome, Nikisha.
Thanks, Danielle, and good afternoon, everyone. So yes, in the interest of time, I'm going to try not to go too fast, but to try to cover the content that I have. I'm going to be providing a high-level overview of Oregon's plan for using the additional CCDBG funds. The 3 areas that I plan on covering this afternoon are a CCDF New Funds Advisory Work Group that we have meeting right now, work that we have underway on Baby Promise, which is our approach to ensuring quality infant-toddler care, and work that we have around expanding our focused child care networks. Now, before I dive into those 3 areas, I just want to begin by sharing briefly that in Oregon, we have adopted an equity lens to guide our work. And while we recognize and are committed to many areas of the opportunity gap, the primary focus of the equity lens is on race and ethnicity. In addition to providing a common vocabulary, The lens includes a set of questions to be considered before making resource allocation decisions and evaluating strategic investments. Really germane to this discussion that we're having today, and it's foundational for our work. So I'm going to shift right now to the what we're calling the CCDF New Funds Advisory Work Group. Now this is a group that's co-facilitated by the Early Learning Division as well as our Oregon Department of Human Services partners. Okay, thank you. The work group is focused on affordability or reducing the burden on families and student parents. We're focused on accessibility and supply, or ensuring that all families have access to quality child care, which is possible through ensuring a quality workforce. And quality, with an emphasis on safe, quality environments and culturally and linguistically responsive child care settings. So some priority areas identified by this group and some work that's currently underway are around infant-toddler quality. We have a Baby Promise initiative that I'm going to talk more about in a moment. We're also looking at using these funds to increase our staff capacity in our Early Learning Division, which is an issue for us. And then finally, around direct services to DHS for our subsidy. And with that piece, we're going to be looking at our subsidy policies to identify areas where stronger emphasis on equity can be made. And we'll be working closely with our Department of Human Service partners to explore this more fully. I'm going to shift gears now to Baby Promise. So a moment ago, I talked about improving the quality of infant-toddler care as an area that the work group is currently working on. The new CCDBG funds provide an opportunity for Oregon to launch Baby Promise, which is a new initiative that aims to address the shortage of quality, affordable, accessible infant and toddler child care options, particularly for low-income families and other populations such as our racially and ethnically and linguistically diverse families, as well as families experiencing homelessness and those who are in the child welfare system. Baby Promise will offer what families want and need: quality, affordable infant and toddler care in a variety of settings that honor parent choice and preference. Now, this initiative, this work in this program is really based on 4 premises. Okay? Creating a system of infant-toddler specialists that provide supports and professional development for networks of providers who are participating will ensure implementation of quality care. Our second premise is that building salary guidelines and standards associated with infant and toddler care best practices will result in adequate compensation for providers. Our third premise is that a targeted approach will ensure our ability to reach the communities experiencing extreme shortages of available child care and challenges of access for our priority populations. And finally, that contracting will allow us to be intentional about building sustainable quality infant-toddler slots over time and address the need to reimburse providers for the true cost of quality infant and toddler care. So just to give you a sense of the timeline for this particular piece, right now the details are still being fleshed out. It's not all mapped out yet. But by late 2018, we're going to be looking at sort of designing a pilot, potentially having some pilot participants selected with a potential pilot to begin in early 2019, evaluating that sometime in the spring of 2019 through summer, and then in the fall looking at expanding the program. So I'm going to turn to the third area that I'd like to talk about, which is the focused child care networks. So the goal of focused child care networks is to increase the supply of high-quality child care in priority populations, okay, targeting resources to child care providers that are serving our children that are furthest from opportunity. Okay. These networks have been proven as a highly effective strategy in Oregon for increasing QRIS providers serving priority communities, recognizing the importance of home-based child care providers in serving many of these communities. And these networks are particularly well suited to create linguistically and culturally specific supports that are staffed by quality improvement specialists that reflect the cohort of child care providers. The quality improvement specialist individualizes the professional development and coaching to meet the needs of that cohort. So currently what we have in Oregon, we have about 30 networks that are operating across the state. And these networks are currently administered through our early learning hubs, okay? And they're designed to specifically target the priority populations as identified through our hubs. With the new CCDF funds, there will be an expansion of focused child care networks within Baby Promise as a method of delivering coaching, professional development, and peer learning. So those are the pieces that I really wanted to cover.
And Nikisha, Michelle is asking whether the networks are specifically for family child care providers or whether the networks include more kinds of care, more care settings.
They include a broader care setting for child care, yes. Conversations, I'm trying to see.
I think you can see from what Nikisha is saying that Oregon is trying to think very carefully using racial equity, vision that they have and commitments to think about how to target resources so they're really reaching into areas that have had the greatest barriers and where there are clear disparities and inequities. So targeting is always a big part of how to address inequities, because inequities are about, in part, the resource distribution that needs to be shifted.
Yeah.
So I think these are great pieces to share, Nikisha. Thank you.
Thank you. And I just want to say that with the equity lens that we're using, that it's a forethought, it's not an afterthought. So that as you're designing, as you're thinking about new funding coming in, that the intentionality that can be set when you're sort of thinking on the front end about how equity is operationalized in the work and in the funding and in the, it just kind of brings a different element to planning when it's done on that front end and when it's a priority and sort of just a natural part of your system.
A couple other questions for you, Nikisha. Yvette is wondering if you could give an example of a priority population that one of the hubs is serving.
Yes, actually I have the list right here. So we have, for example, we have in our Marion and Polk Early Learning Hub, their target population is Spanish and English in a particular area. We have in our Multnomah County Hub Russian and Spanish-speaking providers, African American providers, and these are all sort of delineated by neighborhood. So it's not just a blanket for this, this area. It's really sort of focused on the populations that are residing in the different neighborhoods. Let's see, family child care. So then if we get to one of our more rural areas in South Central Oregon, we have Spanish-speaking, license-exempt, and newly licensed providers as a priority. And then in Yamhill County, we have family child care providers in the rural area, just for some examples.
So the targeting is based upon the needs in the area.
Yes.
Both Kim and Beth are asking similar questions that I think relate to, the set of questions that you asked is how Kim phrased it, and then Beth was saying, would it be possible to have a list of Oregon's questions? You have a document, right, that sort of details your equity focus and the questions that you're asking?
Yes, I have a link that I actually sent out, but I can send it out to you again so it can be shared more broadly. And that will take you to the Oregon
we'll send
equity
that out
lens.
With the slides. Great, thank you.
And that'll
we'll
have
send that out
sort
with
of
slides.
Okay.
we have a couple more questions, and we have 1 minute left. So I don't know if this is a quickie. Let me know, Nikisha. The role of Early Head Start and Early Head Start child care partnerships in Oregon. Is that something you feel like you can speak to quickly?
Probably
or no?
not in probably the 30 seconds we have on this.
Cool.
But
we will answer the questions that are in the chat box and send out resources to people. We'll include these resources. There's a lot to look at that you can use, both what Oregon will share with a link, and then any Casey's Race Matters toolkit that has a list of questions, the Equity Action Framework that Bill created for the Equity Leaders Action Network has questions to dig into. Then there's an expulsion prevention toolkit that we'll also send you the link to that helps you go way beyond the idea of just legislation to end expulsions, but to really get at what's going on in terms of programs, professional development, children, communities, families, to really look at the whole picture. And then there's lots of resources in terms of data and data diversity. So we'll share when we send out the PowerPoint to everyone. And we just want to remind you that this is a webinar in a series of webinars, and the next one is on Monday, August 27th. They're all at 2 p.m. Eastern Time, and the one on the 27th is going to focus on child care assistance and the opportunities that presents for infants, toddlers, and the providers who love them. So we hope that you've enjoyed today. We'll be sending you out resources and the PowerPoint, and please join us on Monday the 27th. Thank you.